one step further so you can understand the breadth of work we are doing around the world. And then I will funnel it down a little bit to focus on the agricultural sector and the kind of work that we envision being done there. So that will give you a slightly bigger overview of what is happening in the agriculture sector for us. Then we will go into mostly theoretical work, which is universe of evaluation. So we'll start with, what exactly evaluations are and how we are going to be looking at different aspects of them. Then we will quickly go into randomization and randomized evaluation, which is sort of the meat of the matter. We'll go over it a little bit in depth. We will do a couple of cases. We'll take live action cases to actually answer certain questions. Then we'll go into the how and the why of RCTs. Then the final part is actually my favorite part, where while we are not doing any case study because of the paucity of time, I'm happy to sort of pull out examples from my own experience and help you understand that when you are running randomized evaluation, what are the key lessons that are coming in from the implementation side of things. Because designing is one thing that you can sit and do on your computers, on pen and paper, inside a lab, but the moment you take all of this design and its beautiful apparatus to the field, a lot of things might go not as per plan. And the final point that I'm going to make is I will very quickly take all of you through our overall website and the resources that we are constantly updating and building that you can benefit from, even if you want to do fundamental research, not just particularly RCTs. So excellent practices, best practices that are gathered from world over. So I'm going to move into the overview. So as Dr. Singh mentioned, JPAL as an organization has been working for the past, I would say 15 to 17 years. Our mission is to reduce poverty by ensuring that policy is informed by scientific evidence. Scientific evidence, what we call scientific evidence, is all of the work that I'm going to be taking you through, which is the evaluation science. How do we do this? We do this through the research that we conduct across, we work with about 200 affiliated researchers and a huge research network of almost 500 researchers across the globe. We do a lot of policy outreach work, and we do a lot of capacity building and training so that the different contexts and the landscapes that we are working in, that becomes more conducive to the use of this kind of scientific evidence. Just to help you understand how we are spread, we currently have more than 1,000 ongoing and completed projects. These are projects, when I say projects, I mean randomized evaluations across 10 sectors in 84 countries. And you can see India is the largest office, though it's not the oldest office, it's the largest office, and we have been doing we probably have conducted close to 200 to 250 randomized evaluations so far. Some are ongoing, some are completed. These are some of the sectors that we work in. Technically, there are 10 sectors. For this particular session, I will focus a little bit on the landscape of agriculture that we are dealing with right now. But the case studies that we are going to use are going to come from education and health. And I know that's going to be a little different for all of you because you have been doing, I'm assuming, a lot of the agriculture specific conversations. So I thought that this might just set the tone a little differently. So very quickly moving on, the agriculture, the research that we do, I'll just very quickly give you an overview. So as I mentioned, what we are looking at is basically research that is going to help people come out of poverty or reduce their hurdles that are keeping them in poverty, right? And agriculture sort of is one of the biggest sectors in the world, right? A lot of, it's not just the main source of livelihood for 70% of the world's rural poor, but the food production lies at the heart of the interlocked issues such as malnutrition, unemployment, migration, that have far-reaching consequences for a number of sectors that I might have shown you, right? So it's cross-cutting in a very, very different way. The problems manifest in very, very different ways. So, again, coming back to the point that I was making, 80% of the extreme poor live in the rural areas, with over 2/3 relying on agriculture for work. Growth in agriculture is in general 2 or 3 times more effective at reducing poverty than growth in other sectors. So this is something very key to keep in mind. I think this should instill a lot of pride in all the students here, that agriculture has been has been proven to have this kind of an impact on reducing poverty as compared to any other sectors. So this advantage, but sadly, is greatest. Sorry, in a good way, this advantage is greatest for the poorest, disappearing when the countries are richer. So technically, the poorer countries will have a higher dividend from investing in agriculture as compared to, say, for example, countries that have become far richer. Then, of course, this is something I'm sure all of you know, that food systems face increasing threats from climate change, growing population, water stress, etc. So this sort of forms the crux of the kind of research landscape that we are looking at. And like, if you think about it, like I mentioned earlier on, while this can be a great driver for a lot of economies, there still are massive hurdles to this becoming the proper driver to a lot of economies. There still are smaller inefficiencies that are causing high impact losses, are causing not the best productivity, not leading to high amount of yields, so on and so forth. So let me just take you through a few numbers. I'm sure a lot of you might have seen graphs like these. Our focus is mostly on areas that we have worked in. So looking at cereal yields across different geographies: Sub-Saharan Africa, South Asia, East Asia, and the US. You can see, and of course, we are taking the numbers right from 1961 all the way up to 2011. You can see that there is a substantial difference in the trends in cereal yields across these four regions, right? So initially, of course, the relatively high yields and more significant growth were in the US and East Asia over this particular period of time. But if you think about South Asia and Sub-Saharan Africa, the yields have started from a much lower level. So they are starting at a 1 or a less than a 1. They have grown more slowly, but we are seeing some amount of a rise, right? Which has been promising. So sadly, the Sub-Saharan Africa yields continue to remain low. Now, there's another interesting thing that we look at is, for example, fertilizer use. So if you think about most of agricultural research, the first thing that comes to mind through any sort of behavioral channel is the use of fertilizer and what exactly is it doing for agriculture, right? So it is, you can think of it as one sort of technological intervention that, which is when used properly, has shown to increase yields across time. And we can see that, of course, through this trend, if you look at the same time frame, you can see that the use of fertilizer has been increasing steadily in much of the world since 1960. But you can also see that in South Asia specifically, there has been an immense growth in fertilizer over time. In 90s, of course, it goes without saying that the region had applied the most fertilizer of the four regions that we are looking at, right? But still, if you think about it, our yields are much lower than East Africa or the United States. This suggests that while the South Asian farmers have taken up fertilizer, they might be, there might be something going wrong somewhere, that it's not still leading to the same kind of yields if we are just using these two parameters to keep in mind, right? So if you think about it, there are broader questions at hand, both in the context of fertilizer and other technologies, right? Because fertilizers alone cannot be driving a lot of things. So what exactly could be causing certain kinds of barriers? So, of course, the next thing that comes to mind is actually technology, right? So what is hampering technology adoption? So in my mind, technology adoption is sort of only one part of the puzzle, but for rural economies to, transform and develop, productivity needs to increase, right? So we have to start looking at barriers to productivity first, and opportunities for, extensification of agriculture are sort of limited, especially in economies that are not sub-Saharan Africa, and where, of course, where they have potentially large climate change implications. Now, intensification of agriculture can be achieved through the adoption of, say, productivity enhancing inputs and practices. Many of these solutions exist, but everyone has been thinking why farmers have been slow to take them up. So the kind of research that we are doing is actually looking at unraveling this particular piece of the puzzle as to why the farmers are not making these kinds of investments, right? So when I think about, say, for example, the inefficiencies that might constrain the technology adoption, what we come across, and this is again coming from most of the work that we have done in sub-Saharan Africa, South Asia, we see similar kinds of trends and patterns, similar kind of constraints that are not allowing farmers to make the most out of technology. So there could be certain solutions in the credit markets, in the risk markets, in information, in input output markets. Of course, there are certain externalities that they are working with. There are labor market concerns, there are land market concerns, right? And we are working across all of these 7 dimensions, trying to understand what kind of solution would be able to support farmers across the globe to sort of make the right kind of decision, to adopt and take up the right kind of technology that might be beneficial for them. And therefore, again, going back to the fact that if this is the kind of investment we can make in agriculture, then it might be driving much larger macro trends for poverty in general for certain kinds of regions, right? Now I'm going to very quickly shift gears, and I have one more thing to say about one more interesting case to talk to all of you about in terms of, in terms of agriculture. But before that, I just wanted to switch gears and say that, while all of these things are there, but how exactly are policies made, right? Agriculture sector, it completely, when I'm saying policies, I'm thinking mostly of solutions. When we know these are widely researched problem areas, so why aren't there, solutions that could be helpful for farmer communities to make the most out of technology and solutions available to them, right? Some of them are going to be public driven, some of them are going to be private driven, right? So if you think about it, and I'm going to talk more from the public driven perspective, because agriculture is way too large right now, at least in South Asia, to not think about the public outcomes, right? So if you think about it, there are 2 ways of looking at policy in our world, in my world of JPAL. One is opinion-based policy making, and the second is evidence-based policy making, right? So what we have seen mostly is opinion-based policy making. Now, what opinion-based policy making does, and because I left up the book picture up there, and and Dr. Singh did mention, Professor Duflo and Professor Banerjee, they had written this book, and they've written like numerous books along similar lines. But in poor economics, what they had written is policies fail to actually give people what they need the most, because they depend on 3 I's. The first one is ideology, second one is ignorance, and the third one is inertia. So how exactly are policies made in the first place? If you think about it, who came up with any policy regarding, agriculture? If you think about one particular policy that stood out, there was a lot of intuition, there was a lot of introspection, maybe there was a lot of experience, maybe there was some amount of research evidence, there was opinion, there were certain things that need to be expedited immediately. So something that was urgently required was decided in a very, very different manner. There could be, of course, political self-interest that would drive these conversations forward. But what we want to move our mindset to is this evidence-based policy making. So if every policy maker had this wide range of information of things that could work and have been tested, then that is something that could drive, bring science into policy making in a far more robust manner. So to give you all an example, I'm going to take another, this is my final agriculture example. And like I said, if there are more questions around the kind of work that we do in agriculture, I'm more than happy to sort of send you more materials. But we've actually seen, and I'm going to be quoting 2 papers here, one from Sean Cole and Nilesh Fernando in 2016, and the other one from Kasaburi et al. From 2014. So basically what we have seen, and if you think about the constraints that I had spoken to you about like a couple of minutes back, information, risk, constraints, these are the these were the key things that, farmers, especially in South Asia, were dealing with at that point in time. So what we have found is interventions using mobile phones to provide information to farmers have been shown to increase adoption and improve crop yields. I'm happy to go into the details of this, but I'll quickly walk you through, why ICTs have been so, this information communication technology have been very useful, is because we are reaching the farmers directly. That's the first thing. And researchers or any sort of, whether it's a public organization or a private organization that is interested in improving yields or helping farmers adapt and adopt better policies, better practices, this is something which can be directly targeted to the individual farmer's needs. So technology technically can be used to refine the training that we can provide farmers with, increase the points of contact, the number of times you call up an individual farmer, the number of times the farmer can call you back. Information is, of course, more accessible because it might be in the local language, it might be in the local dialect, it might be, for the right amount of time. None of us want to hear, pre-recorded messages, for example, that have been running for 10 minutes long, right? But what is the right amount of time that is going to hold the attention of a super busy farmer at the end of the day? You can think of it from that perspective, right? And this has worked much better than the traditional extension models, whether it's TNV, FFS, and more tailored, like I mentioned, to individual farmers' need. Completely depends on the kind of crop you have been using, the kind of inputs you have been using, so on and so forth. Next thing is literacy doesn't need to be a constraint, like I mentioned, as long as you know how to use your mobile phone. This audio extension services or interactive voice response, the IVR services that we have, do not require any reading skills or literacy skills. And what we've seen is interventions using these mobile phones have, like I said, have shown to increase the adoption and improvement in yields. So the two things that we were looking at, one was this mobile agricultural information hotline, wherein we provided information to different kinds of farmers to increase the use of appropriate pesticides and investment in cultivation of newer high value crops, right? Coaching them into the high risk, high return sort of mindset, helping them understand how things are going to go. The picture that you see is actually from the field, from this 2016 project. And what we see is this has a significant impact. And if I have some time at the end, I'll tell you where and what this study has led to. The second thing, of course, is something far simpler, is access to a one-way SMS agricultural advice. So in terms of contract farming, right? So if you provide advice to contract farmers, through this SMS where they just have to press a number and they get the advice, high quality advice coming into their cell phones, has been shown to increase yields by 8%. One key thing to keep in mind, while the Cole Fernando work has been worked on and replicated in different contexts, the Kasaburi work hasn't been replicated yet. So this is only coming from one particular context. Now I'm going to pause for a second. I'm assuming I'm not going too fast or not going too slow. So Aditya, if there is, like, if you want to give me a time check, if you can give me a time check at 1 hour mark, it would be super useful.
Sure.
Otherwise I'll keep talking.
Okay.
Thank you. All right. Now moving on very quickly to the universe of evaluations, right? So like we saw, like I mentioned, we want to move towards a world where scientific evidence is sort of driving policy decisions at times, not just public decisions, but also private decisions in different kinds of context, especially when the vulnerable are sort of involved. So to think about the universe of evaluations, I know while this entire 1.5 hours that I have with all of you is going to be focused mostly on impact evaluation and thinking about impact, but it's extremely crucial to think about impact evaluation as a part of a much larger universe. So in the universe of evaluations, there are program evaluations, there are impact evaluations, and then there are RCTs. So you can imagine, like, you go from this wide universe into something that is extremely specific, extremely scientific, extremely laser focused. Not everything, and I'm sure you all might have heard this, not everything in the world is actually RCTable. Or at times there are things that you cannot, if you cannot randomize, you cannot find the impact towards. And I'll show you how that works in a few slides. But one thing to keep in mind under program evaluation is monitoring. So program evaluation is actually associated with monitoring. At times, monitoring and evaluation is actually confused with impact evaluation. That is sort of not the right thing. So program evaluation requires monitoring. Impact evaluation requires monitoring of a very different kind. Both have their own places, but it's very important to keep in mind that different kinds of evaluations, different kinds of work requires different kinds of questions that you need answered. So not everything can be evaluated. Some things will need a program evaluation, something will need an impact evaluation, and within impact evaluation, certain questions can be answered through RCTs. Now, if you think about components of program evaluation, which was the second bigger sort of circle, or the slightly smaller universe, there is something called needs assessment. When do you conduct a needs assessment? Is when you want to know what is the problem. So if you see, for example, like I mentioned so many examples with the agricultural side of things, is, when you think about in certain areas, despite certain kinds of policies being rolled out, the yields are still low. So what exactly is the problem in that area? So to do that, you need to conduct a needs assessment. You need to think through, different ways in which you will collect data to validate what the problems are going to be. Then you will be doing something called a program theory assessment, right? This basically is going to tell you, say a policy has been rolled out, say the farmers were given, cell phones through which, and I'm just making up this example, but say, farmers were given mobile phones through which this mobile agricultural information hotline could be accessed, right? But the reason why we will do a program theory assessment in that case is because we need to know, how in theory does this kind of a program fix the problem that we are wanting to fix. Then, of course, there is process evaluation, which basically answers the question, does the program work as planned? The government might have thought that, if I deliver mobile phones in this particular manner, everything, these 5 problems could be solved. But it's extremely important to look at the process itself and evaluate whether the program has been able to, take care of the logistics, take care of the delivery. Are people getting the phones at the right point in time? Are people understanding why they have been given the phone? Then comes impact evaluation, is within a particular program, were the goals of that program achieved? And what was the magnitude? What was the size of that particular impact? Right? And it's very difficult. We can say that, oh, something increased or something decreased, right? But when I told you numbers like, there was increase in yields by 8%, or there was investment by 20% in higher value crops, those are coming from impact evaluations. Those are the magnitudes that are significant for a fairly large sample size. Then, of course, the final is cost effectiveness analysis that we conduct. Is like, given the magnitude and the cost, how does it compare to other solutions in the market, right? So all of these are pretty much different ways in which you can evaluate different kinds of programs. Completely depends on what questions you are wanting to answer. Moving forward, like I said, what types of questions can you answer with an impact evaluation? So we are now funneling down, focusing more on impact evaluation. So evaluations of all kinds can be thought to answer 3 different types of questions. One is descriptive questions. You can ask, you need to know how the system is, how the people are in the system, what kind of hurdles or challenges they are facing, what are their demographic details. There could be normative questions that you are looking at. Then there could be cause and effect questions. If I were to give a solution to a certain set of people, what is going to be the effect? What is the cause and effect of bringing in something new into a system in which this kind of solution did not exist. So impact evaluations, what they can do is they can help you answer these cause and effect questions. And if conducted correctly, they sort of will give you the closest possible estimate to the truth. And I'll show that to you in a little bit. Now, coming back, as I was right at the beginning, apologizing to all of you, this is sort of my another point in the case, that it's going to be very difficult to tell you everything there is under the sun about running randomized evaluations, right? Whether it's designing them, whether it's implementing them. So let me just tell you what exactly. So there are certain, I would say, building blocks to running or even designing randomized evaluations. And, for now, you can just conceptualize it into two distinct stages. All right, this is exactly what our session's title treats, right? You have to think about design and implementation. But in reality, if you think about it, design and implementation actually sort of has a lot of overlap. And I'll show you in a minute how. So you actually start with an evaluation question, but that does not come out of thin air. It should be informed by how you think the world actually works, which hopefully, itself comes from more than just vacuum, right? You probably are thinking about, different kinds of research conducted in different place, your own experience, your own knowledge, learning from policymakers, looking at other kind of problem statements, and ideally, I would say high quality evidence, right? Now, if your evaluation is a causal one, like say, public investments that can improve the economy, that is going to be sort of a causal question that you are asking. So your research question or your evaluation question becomes a causal question. Then what you are asking is, does this program actually help the people that it's supposed to help out? Right. Of course, in during the course of this particular presentation, we are going to be looking at, we are going to be calling this intervention. I'll go into the basic typography and language in a little bit, and the kind of vocabulary you need to keep in mind. But you can think of intervention, program, or policy interchangeably. And then, of course, the target group ideally should be a part of your evaluation sample. Then you would want to actually, once your selection is done of the sample, you would want to randomly assign it to receive the intervention, right? You have to break it up into, treatment and control. And I'll show you how we do that in a minute. But you also have to look at, fine, you're going to be doing all of that, but what happens to the outcomes at the end of this, right? How are you going to measure the outcomes? That comes in from survey design. Both through sample selection and survey design, we actually go into the phase of data collection. This is probably the most rigorous and most time-consuming aspect of running a randomized evaluation, where you actually go and talk to as many people as possible within your sample frame and then collect information. During this particular phase, again, one key element of implementation is the monitoring. So when you have assigned people to different groups, you have to monitor them very, very closely. You also have to monitor data collection very, very closely. So here is another place where the overlap happens. Then, of course, once the data has been received, we conduct the data analysis, and then that leads to results. All of our results that are published are available in the public domain. We have our data sets readily available. But what happens at these two levels, right? You might say that you go in from an evaluation question, which hopefully you didn't think of just in the vacuum of your rooms, but have done some amount of literature review, have caused a theory of change, have some aspects or bare bones in mind in terms of what it could or could not impact. And the results will then tell you whether your theory of change was going to get answered or not. Same thing, the results will also help you, the causal hypothesis. It's going to actually tell you whether you can accept or reject your causal hypothesis. If you say that, something is going to happen at X%, it may or may not happen, or at what level of significance it may or may not happen. And that is exactly what your data and your random assignment is going to help you very, very clearly and confidently believe in. Now, for the sake of this particular 1.5 hours, the key things that I wanted to help you all understand is when we are thinking of evaluation questions is we go through this entire process of trying to question why evaluate a bunch of case studies. You can find it very, very easily on our website, and I'll show that to you in a minute. I just went through the crux of the matter. And when you're thinking about theory of change and survey design, we have resources on measurement. I'm not going to be covering that right now. Then, of course, within the intervention, target group, random assignments, sample selection, all of that, you first ask the question of why randomize and what are randomized evaluations. I'm going to be covering those. And of course, random assignment and sample selection are again, you can spend 3 to 4 hours just talking about these things. And I'm sure some of you have already gone through this as you were going through your, statistics and econometrics classes in general. So I'm not going to go into that, but again, I'll show you where the resources are. We also do discuss things like post-design challenges. Once the design has been constructed, what happens when it goes to the field. I am again going to touch upon it very, very briefly, but mostly I'm going to take you through the lessons learned and the things that you need to keep in mind so that you at least have very quick pointers to cull through the resources that I am going to be sharing in a little bit. Okay, very quickly now, moving on. So randomization and randomized evaluations, right? Like I mentioned that, while JPAL has been running for almost 15 to 17 years, randomization and randomized evaluations, or RCTs, have been used by different kinds of industries. So pharma industry comes to the mind first, but a lot of social programs in the past have been using, in different countries have been using randomized evaluations or different variations of randomized evaluations. Sociology, anthropology, psychology, economics has been using this for quite some time. And we will see like what the, I would say the building blocks of actually going to do this. Now we will take a step back. I will tell you a little bit about the vocabulary. We are going to focus our attention on immunization. So, immunization is something that we have been working on for quite some time. So the example that I'm going to give you is going to be from a 2010 study that we did in Rajasthan. And, subsequently, we scaled it up to the entire state in Haryana much later on. And again, brilliant insights from that particular study. Now there are state-wise changes in terms of how immunization incentives are looked at, how immunization delivery is being looked at in different kinds of states. So you can imagine that it came from a very simple problem statement, right? That despite there being the availability for free immunization, full coverage rate amongst children remain extremely low in many developing countries, right? In India, again, there is a huge variance in this, but it still is low enough for us to consider this as a problem. When we say full coverage, we are actually talking about the 4 or 5 vaccinations that children need to receive before a certain age so that they can be fully immunized and free from any sort of future health issues that could come into being if they were not immunized. So when we started thinking about what could solve this problem, if there is no supply side constraint, right? Everything is freely available. Yet people are not going to avail this free immunization service. So what could be going wrong? So we realized that there could be some amount of concern about, is this reliable or not? So you can think about the COVID vaccine right now, right? So not a lot of people are actually, while it's open to a certain age group, not 100% people are going to be readily going in to get the vaccine because they may not find whatever they are reading or whatever they are seeing as extremely reliable, right? So that was the first barrier that we wanted to break, is to bring up monthly immunization camps set up in villages so that people could see this is a village level thing. They don't have to travel far and wide, and when they see their neighbors getting their children immunized, maybe there can be some sort of spillover effect. Despite all of that, say for example, if it still wasn't going up, then we were ready to provide small incentives to the mothers conditional on having the child immunized, and a larger incentive when the immunization course is completed. Like I mentioned, like, there could be some children who are being immunized 3 out of 5 of the vaccines that they are supposed to take, right? So it's not just a problem of take up, it's also a problem of full coverage. It's not a one-time thing, so people have to plan accordingly. So we also brought up the intervention where small incentives could be provided. Now, if you think about this, it's fairly straightforward, right? Two, fairly good ideas that could be seen whether or not this can be, this can improve immunization rates. But here enters causal inference, right? What happens is, like I mentioned in impact evaluation, we have to look at the cause and effect, right? While we look at cause and effect, in a lot of contexts, it means something very, very, very specific in impact evaluations. So we can think of causality as the singular effect of a program on an outcome of interest. So if you think about the immunization study, the points that I gave to you, you can think of, the effect of providing a mother with a small incentive first and a large incentive at the end. What is going to, is that going to have an impact or an effect on the outcome of interest? Your outcome of interest here is whether or not that mother's child is getting vaccinated, is getting immunized, right? The second thing is it's independent of any other intervening factors. And I'm going to get to that in a second. And then after all of this, it's our goal to estimate the size of this effect, right? Accurately and with confidence. And that is where mathematics comes in. But if you were to think about causal inference a little more in depth, it is not very straightforward to establish that a relationship is causal, right? So if you think about it, if it is, I don't know how, so if you think about an example of, giving free lunch in schools, right? If you say that I'm going to provide free lunch in schools in a particular class to see if that has any impact in children's attendance, right? And maybe you will see a difference. Maybe you will see that, yes, you, from the day you've started giving free lunch in school, a lot of other children who were absent were coming home, were coming to class more often. But that automatically does not imply that you are seeing that because of the free lunch. There could have been a lot of other things that would have been going on. There could have been a clear road constructed between the road and the village from which the highest amount of absenteeism was been driven, right? There could have been, a lot of other things. Maybe parents were pushing their children to go to school more often. Maybe children didn't have money to stay out of school and cut classes, so on and so forth. So there could be so many other things. So you cannot, to establish that that relationship is causal, you need to do a lot of groundwork. And I'll get to that in a minute. But if you think about it, when we are trying to make this causal claim, what are we essentially trying to do, right? We are trying to say that there are no other factors other than the program of interest, which is, providing free lunch or, providing incentive for immunization, that is causing these changes that we are observing after a fixed period of time. In other words, the amount of change that we actually observe in our outcome of interest is solely due to the program that we are evaluating, and no other factor or factors are actually responsible for that change, right? And this is something very key to keep in mind. And we'll be going through it a little bit more, but now coming back to like, how exactly are we going to measure the impact, right? So this impact in the impact evaluation is actually the causal effect, right? And it's defined by the comparison between the outcome sometime after the program has been introduced and the outcome at the same point in time had the program not been introduced, or what we call as counterfactual. Now, this might seem extremely strange because, how can you have two realities existing simultaneously, right? And that is the exact point that we want to get into, right? You actually have to think about that particular duality of realism or reality that we are dealing with, where the counterfactual actually represents the state of the world that the program participants would have experienced in the absence of the program, if they had not participated in the program, right? The counterfactual does not represent a state where the participants received absolutely no services, but rather than the state of the world in which the participants receive whatever services they have received had they not participated in the program being evaluated. So what's the problem, right? The problem here is measuring the same person in two different states at the same time is impossible. I can either go to school or I can not go to school. You cannot have a particular counterfactual where what would have happened if I would have gone to school because I did not go to school, or what would have happened if I didn't go to school because I did go to school. So I, as a program participant, can only exist in one of these realities, right? So then, if a person cannot be observed simultaneously in two different states with and without a program, this is actually called the counterfactual problem. So what is the solution in all of this, right? What we try to do is we try to mimic or construct what the counterfactual could have been. And that is exactly what the different impact evaluation methods actually try to do. So I'm going to take you through some of the few methods that are like top of mind right now. And of course, these methods vary in the extent to which they are able to mimic this counterfactual. How confident can you be in this counterfactual, right? Now, the other thing very quickly to start with is say immunization rates. The program starts at a particular day. We are seeing like a rising curve right now. Can we say anything about the impact of this program? So if this is pretty much the graph that we are looking at, what could be the impact of the program? Can anyone, just, you don't need to raise a hand. Can you tell me, anyone can tell me whether it's positive, negative, zero, you don't have enough information?
Not enough information.
Not enough information.
Exactly. I'm glad. Yes, there is not enough information because what we have missed is basically the counterfactual. While the program will run its own course, we don't know what would have happened at the same time frame if there is no counterfactual to compare, right? So let's take one example where the counterfactual could have been, we have a way to measure the counterfactual and the counterfactual is less than uh, the reality, right? And what we see as impact is that there's a positive significant impact there. I won't say significantly just yet because it completely depends on other things, but the size is large enough for us to detect it, for example. What could be other options? The counterfactual could take a completely different route. We don't really know. Your program could absolutely be proving to be negatively impactful on its program participants. Or you could have a very different slope where, again, you will see a higher impact after the program starts, but it's not that the trends are consistent. So there are different ways of looking at these. And again, different kinds of context, different kinds of problem statements will be driving this very, very differently. So very quickly moving on, again, going on to the big counterfactual problem is that, like I mentioned, the counterfactual represents the state of the world that the program participants would have experienced in the absence of the program. That is, they had not participated in the program. Like I mentioned, the counterfactual cannot be observed. The solution that we have is to mimic or construct this counterfactual. Now, how do we go about constructing this counterfactual? So if you think about it, we are actually dealing with people. We are not saying that the red block is painted blue or the blue block is painted yellow, so on and so forth. These are actual individuals and humans that we are talking about. So it takes a lot of, I would say, a lot of design thinking, a lot of thinking along the lines of causality, doing a lot of literature reviews to create the counterfactual in a particular context, in the context of your research question, right? This is usually done. The simplest generalized solution is going to be, it's usually done by selecting a group of individuals that did not participate in the program. But there could be a lot of problems with this particular point, right? You have to have this in an extremely controlled environment, and we are going to go into randomization in a minute. But group that did not participate in the program is technically going to become your counterfactual or your comparison group, right? We also call it the control group because it's treatment and control, and we are borrowing from the language of RCTs in general used worldwide. But your comparison group would give you basically the answers to the world of the counterfactual, right? But how do you select this group is the key decision in the design of any impact evaluation. It's highly nuanced. And like I said, once I give you all the resources, you will see there are hours and hours of lectures on how exactly for a particular context you get to design this particular group of people. So I'm just going to be I'm going to make it very straightforward and simple and say that the idea is to select a group that is exactly like the group of participants in all ways except one, which is that they have been exposed to the program that is being evaluated. So you can think of two households lying side by side. You can think of two children going to school in the same class, having the same kind of backgrounds, but it's not as simple as that. It has to be identical, and it's not just going to be identical if they are from the same village or from the same school. And I'll show you in a minute how that is going to work out. But technically, they need to look like, it cannot be apples to oranges. It has to be green apples to green apples. So basically, the goal will be to be able to attribute any differences in outcomes. So if both individuals are absolutely identical, we are going to be able to attribute the differences in outcomes. So if one person is coming to school or one person is getting immunized as compared to the other one, we can very confidently only attribute it to the program and not to any other factors. And again, I cannot, the reason why I'm spending so much time on this one particular concept is an impact evaluation is only as good as its comparison group that uses to mimic the counterfactual. So if you don't have a pure control, if you don't have a control group that is going to be giving you enough confidence, then technically you haven't designed a very robust randomized evaluation or an RCT. So now shifting gears a little bit, broadly going into randomized experiments. Now we are going to look at a few impact evaluation methods, but I'm sure during the course of this particular series, you will have looked at a lot of other experimental, non-experimental, quasi-experimental methods. I'm going to touch upon a couple and show you how, just for comparison's sake. So we start with randomized experiments. Finally, we are getting to randomized experiments, the meat of the matter. They are also known as randomized assignment studies, randomized field trials, social experiments, RCTs, randomized controlled experiments. So there are various names for the kind of work that we do. Then we look at, other impact evaluation methods, right? These are non-experimental or quasi-experimental methods. And what they do, what is different from RCTs is that they argue that a certain excluded group mimics the counterfactual. So they vary a little bit from each other by how they are constructing this particular counterfactual group. So we will go through pre-post, simple difference, difference and difference. I may not have time to go into multivariate regression, but again, there are more nuanced ones, which is like, statistical matching, interrupted time series, IVs, regression discontinuity. This, while we can, I would say we have enough evidence or we have enough knowledge in terms of testing the assumptions associated with all of these, all of these methods, it's the scope of statistical matching, interrupted time series, IVs, regression discontinuity. In this particular context, the assumptions are still not very strongly tested. There's a lot of work going on definitely there, and also there are new data methods coming up which makes all of these particular evaluation methods a little more important. So completely depends on, like I said, your context and the data set or the data source that you're dealing with to sort of use certain kinds of things. But for the sake of this particular conversation, we will keep it limited to the first three. So now the RCTs of how and why. Now, I know we looked at very quickly, we looked at the problem and solution of, of the immunization piece. But now what we are going to do is we are going to take up another example. And this is in the education sector. It's a fairly long running, but a fairly, I would say, this takes me back to the start of my career, because this was around the same time when I had joined this particular space of trying to understand RCTs and social experiments. So what we are going to talk about is the Bal Sakhi program. This is something that we've done in collaboration with Pratham, which is a leading education NGO in India. We were going to look at, so it was a very simple thing that children have low learning levels, and we were focusing on classes 3 and 4. We were doing this across 2 years. We were doing it in Gujarat, so in Vadodara, and we were doing it in Mumbai. So these were the 2 areas in which we were working. And the program was fairly simple. So we knew that children were not of classes 3 and 4, they were not reaching the kind of learning levels that they should be reaching, and especially in math and language. So in language, it could be Gujarati Hindi, it could be Marathi Hindi, depending on where exactly the school is based and the language that is being tested. But what happens, so to increase learning levels, we can think about, there are so many different ways of doing it, right? Like I had mentioned, like you can give people free textbooks, you can give people an additional hour of school work, you can give them more homework, you can give them, I don't know, you can gamify content, you can get teachers to attend school more often. So there are so many factors that can drive learning levels. But this particular program was quite unique because it was bringing in Bal Sakhis. So Bal Sakhis are basically, as the term suggests, it's like friend of children. These were women from the community who were going to tutor children for a specific time period in certain classes, and then we were going to look at learning. So you can think of it as, it's not the very simple model where after school you go to tuitions, which is pretty much has been the norm growing up in India. But this was slightly different because this was still in school. You were working with people that you knew from the community, so there was already a deep trust between the children and these Balsakhis that were going to come and teach them a little better. And what we wanted to see is, what was the impact of this kind of a program? Like if schools started introducing X number of hours worth of teaching through community leaders or community teachers, then what could be the effect on learning? So that is pretty much the premise. Now, if we were to assume that the Balsaki program is using a randomized evaluation, so what are the key things that we are going to do, right? What is this going to entail? How would we do it? And what would be the advantage of actually using to evaluate the impact, right? Why are we even going down the randomized evaluation route, right? We can very well provide this program and just see what happens to scores over a period of time, right? And I'll show you what difference it drives in a minute. So before doing that, I think it's important for us to do the basic setup of a randomized evaluation. So if you think about the Balsaki case itself, we have a total population. Then we think about a target population, right? From the target population, then again, there is going to be, a random sample of the evaluation sample, and there are going to be people who are not in the evaluation. Within the evaluation sample, there is going to be random assignment of individuals into treatment and control groups. So you are actually funneling things down to the extent where you can have a very clear counterfactual. And I'll show you how we do that in a minute. But the evaluation sample that you start off with in this particular case can be certain schools in which the Balsaki program was going to be, could be given. But some schools received it and some schools didn't, and we'll see that in a moment. So this is going to take, the first thing that we are going to do is we would take a sample of program applicants, right? Who are going to be the people who will be eligible to be a part of this program. It would be children in the age group of, in the class groups of 3 and 4. Their schools have to be in a particular place. Their location has to be in Vadodara. There have to be community teachers available, so on and so forth, right? Then once you have your evaluation sample, by selecting from the target population, what you do is you randomly assign them to either the treatment group or the control group. And of course, the treatment group is offered the program. The control group is not allowed to receive the program, especially during this evaluation period. But of course, after the efficacy of the program has been established, this becomes like a general program, and everyone is eligible to achieve it, available to use this particular program. So keeping this in mind, when I say randomly assigned, it's not very simple. It's not that, you make a line and come and you say, okay, you go left and you go right. That's not how you do it. But there are, there are key things that we actually need to keep in mind. The main principle here is going to be the two groups, this treatment group and the control group, on average, have the same observable and unobservable characteristics, right? So it cannot be that one person in the treatment, or people in the treatment group are systematically different from the people in the control group. It could not be. So you have to start with the same or almost insignificant level of differences between reading outcomes. Or it could have been all the smart people turned up in the treatment group, and which shows that, the program did really, really well, but it was more about the kind of people who were assigned to the treatment group rather than the program itself. So it would have been very difficult to decouple those kinds of things, right? So you have to do that check right at the beginning. We have to keep in mind that the assignment, because it's randomly done, it's done purely by chance. And we will have to provide a large number of units. So two things: one, it has to be randomized. Second, it needs to give you enough sample size for you to detect an effect size. And that effect size can be, depending on your power calculation, you have to have some sort of a baseline or a critical minimum detection size. But these are very key things to keep in mind. And theoretically, if you can imagine, the treatment and control group, because they are randomly assigned, they should be same. Now, within this, impact is going to be the difference in outcomes between the treatment and the control groups after the program, as we saw in the immunization case as well. So now, if you think about random sampling and random assignment, if this is sort of the, if I were to draw a random sample from this area of interest, say this is my entire population, what does that look like? Then I am taking up randomly selecting these units. Now, these units could be children, these units could be at the individual level, at the school level, at the household level. It completely depends on the kind of research question you are asking, completely depends on the constraints your research design has, keeping in mind the internal validity, external validity problems that you have to decide what your unit of randomization is going to be. Moving forward, then what you need to do is, now that you've selected this random sample, this becomes sort of your evaluation sample, you will be randomly assigning these people, if you remember from that diagram before, into treatment and control. So this is going to be random. And when I say random, again, technically it will be a coin toss, but it has to be many, many coin tosses. So we technically use softwares to actually randomly assign people. We have robust codes that should not break down, no matter how large and nuanced the randomization design is. And all of them are in one particular group absolutely by chance. Then we randomly sample from both treatment and control. That sort of becomes your final random assignment and random sample at the end of the program. Now, what we look at now, after you have done
Jyoti,
that, what we see is now, yeah,
sorry to
1 hour
interrupt.
mark, Aditya?
Yes.
Okay, all right, thank you. I think I'm going at the right pace. I should be able to complete it. Thank you so much, Aditya. So now, again, going back to, if you remember the reds and the blues, this is exactly, so this is from the sample in Vadodara. I'll show you the Mumbai ones as well. So the red groups and the blue groups, the treatment and the control, we are looking at, the first year and the second year, grades 3 and 4. These are mean normalized test scores. And these are pre-tests. So before the Balsaki program came in, what are the normalized mean test scores? I think the most important thing you need to look at is the right-hand column, which is the difference. You can see that there is no difference or no significant difference between the normalized mean scores for math and language across treatment and control. And that should give you enough confidence that your randomization has actually worked. So it's very, very important. If this is showing up, significant differences on the observables and unobservables, then you have not randomized correctly. So you will have to go back to the drawing board and think about what can be done. With Mumbai also, as you can see, the differences are not significant. And what this is called, this is basically called, this is I would say, a snapshot of the balance tests or balance checks that we run. I'll come to that in a little bit soon, but thinking about all of this, now I said that while we can look at a bunch of different methods to actually evaluate randomized, actually look at the impact of a program, we have to always keep in mind what the key advantages of randomized evaluations are. Because the members of the groups, treatment and control, do not systematically differ, right? Like you saw that the differences were not significant. And this is at the outset of the experiment. So at the outset of them even ever meeting the Balsakis and learning any new material, any difference that comes in once they are exposed to the program can be attributed to the program rather than to any other factor. And that is sort of, for the lack of a better word, that is sort of the science and the magic of the randomization, right? And this is theoretical, right? This is what we are expecting that to happen once we randomize. And once we see the balance test, you are like, okay, fine, I'm good on the randomization aspects, and you can take this theory and test it out. And again, very important, if properly designed and conducted, the randomized evaluations provide the most credible method to estimate the impact of a program. This goes without saying because there is so much close amount of scrutiny, and like I said, I mean, there are of course system level interventions that have happened around how to consistently produce and think about high quality research. This is something that is pretty much at the top of everyone's minds in terms of how randomization can be reproducible. So every single time you actually randomize this, I'm just going to pause and take go on a tangent once, but like I showed you, the reds and the blues happening between the treatment and the control groups, like I mentioned, that we do it in a statistical program. It could be R, it could be Stata. We actually make sure that this is reproducible. So it's not just the balance check, but this has to be reproducible. This has to be replicated. Just because it has worked on your computer, I cannot take it as a given that it will also work on my computer, because there could be a coding error. There could be something else that's showing me false positives, so on and so forth. So it goes through a huge amount of scrutiny as a process itself for it to be considered anything but this. So that is one very key thing to keep in mind, which is what we mean by, if properly designed and conducted. This is a part of evaluation conduct itself. Now testing the assumptions, right? So what was the assumption of a randomized evaluation that must hold for it to give the true impact of the program? One, like I mentioned, no randomization failure. The randomization will generate two statistically identical groups. There are no failures in your coding. There are no failures. It's holding, the code is stable. There is nothing going wrong at the analysis point, and you are extremely confident in the results that you're seeing. And how can you test whether this assumption is true? Is, like I mentioned, the balance test, right? When you compare the characteristics at the baseline, which is at the beginning of the program, on observables and unobservables. So there could be, the control variables you're going to run in your regression. It would be the impact or, outcomes of interest, so on and so forth. There are typically, the balance test is sort of a fairly long table in a lot of evaluation literature. So that is one thing to keep in mind. Then we shift gears and think about the non-quasi experimental methods, and we look at the methods of estimating the impact using the same data. Okay, so while we did conduct randomized evaluation on the Balsaki program, what if we were to use the data to see if we were running a different kind of analysis, or we were thinking about this program a little differently, how would the results look like? So the four things, I'm only going to focus on three right now because of paucity of time, but again, my slides will be will be available. We'll go through multivariate regression and others as well. So now the pre-post, right? The pre-post is technically the before and the after, right? It is the most common impact evaluation method that compares the average change in the outcome of interest before and after the program. So in this case, we would look at the change in test scores over the school year for the Bal Sakhi children. Now, if you look at the numbers here, the pre-test score is 24.8 and the post-test score is 51.22. The difference is sort of 26.42. I'm sorry, there are some chat messages. I will not be able to see them. I will circle back to them at the end of the session. And thinking about, under what conditions can this particular difference of 26.42 be interpreted as the impact of the Bal Sakhi program. So if you think about it, you are technically using the same children before and after the program. And the counterfactual assumes that nothing has changed between the 2 years. So think about 2002 to 2003, there has been no change, and all the change is being driven by the Bal Sakhi program itself. But so many other things could have changed, right? Like, learning is extremely dynamic for children, especially of that particular age group. So, the most obvious thing that could have happened would have been, the natural learning gains that children go through any which way. But it is so wrong to actually confound this and say that this is actually attributable to the Bal Sakhi program. Right. So you are sort of attributing the entire change to a program, assuming that, test scores and learnings would have remained exactly the same if. So the assumptions are fairly flawed in this particular case. So this is basically what you are assuming, that everything would have remained at 25, and that is what is driving the 26.42 percentage point increase. If you look at simple difference, it's very simple. In fact, is the impact of comparing the participants to the non-participants, right? So children who got the Bal Sakhi program with the test scores of the ones that did not. And this, again, as you can imagine, is quite a flawed way of looking at programs, because it does not take into account, say, for example, the systematic differences between the Bal Sakhi and the non-Bal Sakhi students, both before and after the program was implemented, right? What you are seeing here is, for the same data, for the same program, if you were to run a simple difference, making these kinds of flawed assumptions, or semi-flawed assumptions, the average score for a child with a Bal Sakhi program is 51.22. The average score without is 56.27. The difference. So basically, what we are saying is, children with this additional program are scoring much less than children without this particular program, right? Again, this, like I said, this does not take into account the systematic difference between the students. The students who were selected by the teachers for the program could have been, poorly performing ones, could have had lower test scores as compared to students who were not selected for the program, because this was, at the end of the day, remedial learning, right? So that could have been the case. And this is technically your problem of selection bias. I'll go through that selection bias problem in a bit, but this is basically what it's showing. We don't really know what has been driving that negative 5.05. Now, with selection bias, I think it's very simple. You have the population, you have participants, and you have non-participants. You conduct the baseline, they're not very different maybe, or they are different. You have the intervention, you have the end line. This is pretty much what the flow is. But the problem of selection bias is a reason an individual actually participates in a program, right? It is correlated with the outcomes. So if you think the children who were placed into this remedial learning group, or were given, some kind of extra hours at school, they were any which way systematically correlated with the outcome of interest. It could be negatively correlated, it could be positively correlated. But what randomization does is, randomization takes care of the selection bias, which might cause, like later on during analysis, you will see a lot of bias that creeps into your design itself. You cannot, of course, say that this difference is due to the program or any sort of pre-existing differences. The final one, of course, is, the difference in difference. Compare the change in test scores of the children who got the program with the test score of children who did not, but you do it a little differently. So average score for a child with, average score for children with Balsakhi, pre-test and post-test, this is the difference. Without, this is the difference. So you take the difference in difference, and under what conditions, again, the question being, under what conditions can this particular impact be interpreted completely as the impact of the program, right? What you're seeing is, you're seeing, the movement in lines, but you don't really know whether, this is going to be, if you start with your population, several could choose, select to join the program or not join the program. It sort of becomes very, very difficult. It compares the change in outcomes for the program participant to the change in outcomes for completely non-participants. And like we said, that also has selection bias, but it could, cause any number of differences could be driven because of that, right? So now when you look at it, so this is sort of like when you look at the actual impact. So 6.82 points is actually the difference in that particular difference. Like I said, there are other methods when we look at it. I'm not going to go into the details, but there are certain assumptions that can be tested through this, but certain assumptions that can be made. But again, the problem here is the assumptions are not completely testable. So there is a lot of work going on in this particular field, and a lot of our researchers are actually looking into these other methods as well to try and expand the scope. But we will see where that takes us. Now, again, when we look at the summary, I thought this would be a very interesting thing to keep in mind. As you can see, across these three, so I didn't show you the regression, but through the regression, the impact estimate was 1.92, and it was not significant. But statistically significant at the 5% level are all of the other methods, but giving you completely different size of estimates, right? So why does it matter? Like, why does the method matter, right? It matters because of the kind of assumptions, or how confidently can you depend on the method itself. So, while different methods will be giving you different estimates, they might be statistically significant completely depending on your sample size, other kinds of concerns. Something somewhere might have worked, not worked. But what you can confidently say is that they are not very close to the truth. So the randomized experiments, if you think about, like, very clearly between treatment and control, you have already established statistically that there is no systematic difference between the two. You go for, give them the intervention, or you give them the program, and then this is going to be the difference in the impact. So then why randomize? So that is another key thing to keep in mind. So why randomize? There are, like I mentioned, there are many ways to estimate a program's impact. This particular conversation with all of you argues in the favor of randomized experiments. And again, to remind you all that the conceptual argument is that if properly designed and conducted, randomized experiments provide the most credible method to estimate the impact of a program, as you all saw. The empirical argument is different methods can generate different impact estimates. So I'm going to quickly drink a sip of water. All right, moving on. Now, key lessons from implementation. So as you saw, most of the examples that I sort of took you through, they were not happening in labs. They are not happening in closed doors. We are going out into the field. When you are looking at that entire list of, the flow chart that I showed you right at the beginning, you're going from your theory of change into your, research question, which is going to be a causal question. You're thinking about your randomization unit. You're thinking about your, your power calculations. You're thinking about your sample size. You're talking to partners. You're talking to policymakers. You're having a lot of conversations. All of that is happening, pretty much in a bubble. Once your design is ready, once you identify, okay, I am going to say evaluate the Balsaki program, and how am I going to do it? Who are going to be my treatment and control groups? I can see that I have conducted the baseline, I have conducted the balance test at the baseline level itself. I see no differences. All of that has happened, but then you are going to move into the field, right? And it probably is I won't say it's probably the most rewarding and also the scariest part of taking something into the ground, because at times you have no controls in the outside world, right? Even if you're running like natural experiments, maybe not just policy interventions, but even with natural experiments, it's very difficult to predict upfront what are the million things that could go wrong. And I will actually give you a cheat sheet of things that you can look out for and what that means. So again, in the conception phase, of course, it is important, and it allows to design an evaluation that will be able to answer your research question. But what happens actually is that the evaluation implementation phase, which is exactly what, say, my team does, it's extremely important. A lot of things can go wrong, right? You can think of, let's think about, I can give you the example of, and this is hypothetical, but like I had mentioned, that providing mothers with incentives to bring their children for immunization and receive full coverage, the incentive could be very different, right? So in that particular study, we had used a kilo of lentils to provide as an incentive, or oil. So all of that requires, say, for example, procurement. Now, what happens if I lose a truck worth of that particular intervention material, which is going to be given to the mothers so that they can turn up in time, right? Or it goes to a completely different village, which was supposed to be a control village. A lot of those kinds of things, there could be acts of God. You could, there could be heavy rain. And I don't know whether you all have seen, but we have enough number of pictures on our websites between IPA and JPAL that you can see our enumerators who are collecting the data are wading rivers in up to, like, I would say, chest high water. So there could be data loss problems. There could be so many other things that could go wrong, right? So what is extremely useful to keep in mind is that after you have designed uh, an experiment, you have to be ready to see it get unraveled on the field as you are testing out your assumptions. So it's never going to be a foolproof thing that sort of gets designed in an airtight chamber and then just like is implemented on the ground. There is a lot of pre-testing that keeps on happening in between, and that's where the kinks get ironed out in terms of what needs to be done and what doesn't need to be done. So, like I said, I mean, the implementation phase is going to be messy, but what you should be able to do is you should be able to identify, as a researcher, you should be able to identify what could be your main threats to validity during the implementation phase of the evaluation. If you see there are certain risky aspects, there are things that can, cause problems, you need to start defining strategies at the conceptualization stage itself to mitigate these threats. You could, of course, pilot out some responses. You could, train enumerators. You could train your team. There are a lot of strategies. And then some of the strategies could be done during the analysis phase, keeping all of that in mind. I will just very briefly touch upon those. So, threats to validity, what are the major ones that are, sort of key in this kind of literature or in this kind of area, is unexpected spillovers. What happens when your treatment group and your control group are no longer just treatment and control, right? What if some aspects of the treatment group of the program has spilled over to the control group, right? What happens if somebody, our assumption was that no one in the control village, for example, will have access to the information of this immunization camp. Let's assume that's the example. In that case, what happens if one household has been visiting another household in one particular village, brings over all the women from that particular village to get this particular incentive and receive immunization from those camps, right? So those kinds of spillovers, and there could be so many, right? There could be partial compliance and sample selection bias, right? Partial compliance could be, people are selected, but they are not complying with the treatment. There is no take up. What happens then? What do you replace them? Do you not consider them? So there are different ways of looking at this, and two very clear, well-documented, well-researched ways of doing this is looking at it through the lens of intent to treat, which is ITT, and local average treatment effect, which is LATE. So both of these methods are fairly useful to take care of this particular problem. Then there are behavioral responses to evaluations, right? What happens when people are behaving a certain way because they know they are a part of the evaluation, they know they are a part of the treatment group, so they are behaving differently from how they would have otherwise So keeping in mind, so which is the reason why, the double blinding works at times, there are, more controls in place in terms of how you look at different outcomes. So, there are different ways, you can look at Hawthorne effect, there can be a bunch of different things, surveyor biases, so on and so forth. Then comes the research transparency part, which is, things like the guardrails that allow researchers to think about these kinds of things, but also very transparently report about these things. You can read more about this, in a little bit. I'll show you the resources. But I think, again, coming back to the point, the biggest thing that RCTs have, the greatest strength, is the internal validity. The science on which that is based, it's like sort of unwavering, and everything undermining it must be considered carefully. Like I mentioned, the design phase and the power calculation phase for young researchers is extremely important, but so is the ability to face the challenges during the implementation phase. Also, it's extremely important to distinguish well between attrition, spillovers, and partial compliance. You cannot get mixed up in terms of what strategies you are using for, if your sample has attrition, if your design has spillovers, if there is partial compliance to your program itself. So these are key things to keep in mind. And again, there is a lot of lovely literature, lovely resources, and I won't be doing a lot of justice if I wanted to do it in 5 minutes. So I'll show you that in a minute. But also for you, like I mentioned, like the research transparency and the behavioral responses to evaluation is being able to be aware of the experimental effects. I have like a lot of projects I have worked on are in the sector of social networks. So basically looking at information related campaigns and how people react to different kinds of things. There are times when you provide people with incentives to sort of play a game to try and elicit certain kinds of responses, you will see that they are behaving a certain way because of the incentive, or they are behaving a certain way because of the experimental design itself. So very quickly, when do we do a randomized evaluation? The important question you want to or need to know the answer to, right? When there is an important large scale question you want to look at, right? The timing, you cannot be too early or too late into that program conversation. So like if you go back to the Balsakhi example, it could not have been at the fag end of the program, because then, the entire pool is already exposed to the program. So what is the point of even dividing people into treatment and control? Not too early. If it is too nascent, then the program has not been, designed or validated enough for it to be taken forward. The program is representative and not gold plated. And because if the program is gold plated, there might be other kinds of experimental issues that you're dealing with. There could be ethical concerns, or it already tests a basic concept you need tested, right? So you don't need to just test a basic concept through this. You have to be very mindful that time, expertise, and money is required to do this correctly. There are certain phases that require high amounts of expertise, both in econometrics and in economics, as well as local expertise, ethical expertise, making sure the morals and moral repercussions and societal level, general equilibrium, everything is in the right place to actually be able to do this correctly. You have the time and capacity to develop an evaluation plan to prioritize this. And also there needs to be an opportunity. So there needs to be a policy window, there needs to be a product window that you can be doing this. When not to do an evaluation, when the program is premature, like I mentioned, and there is considerable tinkering to work well. So if you are going to make changes to the program as you're running the randomized evaluation, then it might as well don't do the randomized evaluation. When the project or the sample is too small scale to randomize into representative groups, because if you have a very small scale sample, you might not get significant or insignificant figures in your balance test. If there is a positive impact that has already been proven using rigorous methodology and resources are sufficient to cover everyone, then you don't need to do this. So very simple example you can think about that, there were random experiments or experiments already conducted on the different kinds of vaccines that are going to come into the market right now or are in the market right now, right? So there's no point in us trying to do another randomization, because there has been rigorous testing of this kind of a solution. The resources are enough to cover the entire global population. So there is no point in withholding this to not give to a particular group and give it to a particular group first. And after the program has already begun, you are not expanding anywhere else. So that's not a good point to do this. So I'm going to very quickly take you through resources. I know I'm running short of time, but I will, let me just show you resources. 1 second. I hope you can all see my screen.
Yes.
Great. So this is basically our Poverty Action Lab website. This is basically the URL that you need to follow. But what I want to draw your attention to are two very important things, right? You can learn more about the organization, of course, by looking around. But in terms of other things you have to look at is research resources is the first one. So you can see here, if you want to run high quality, research, especially dealing with randomized evaluations in, across the globe, this is one place where you will find very, very high quality resources that will help you. That is, as you can see, it's intended for researchers and our research staff undertaking these randomized evaluations. Some of them have been written and edited by our affiliates themselves. So you can, it follows a project life cycle or an evaluation life cycle, but you can think of, things like conductor power calculation, grant proposals, what are IRBs, ethical checklists, so on and so forth, research design. You have more about randomization, real-time monitoring, data collection and access, so on and so forth, processing and analysis. We have a lot of resources under data analysis if you want to take a look at that. Things. So basically the entire life cycle from actually designing and conceptualizing a research project all the way up to, processing, analysis, and publication. The other thing I want to draw your attention to is while I was more focused on our examples mostly from India and sub-Saharan Africa, but you can also look at our evaluation space, and here you can actually sector-wise, sort of just very quickly look at, the kind of work that we have been doing, and you will see a host of resources, research papers, so on and so forth. And like I mentioned, we have 10 sectors. So you can also play around with, n number of sectors, and we have our evaluation results right here. If you want something quick to read, you can read our policy insights across different kinds of sectors. And, we have our blog in terms of, setting things up. So feel free to reach out to me with any questions. I'm going to stop sharing now. I'm sorry, I'm over by 2 minutes, but I was happy I could complete this by, at least by 5:32.
Thank you so much, Titi. There are a few questions in the chat box if you can answer them.
Yes. Okay. So for the just completed school program, at which level the treatments were assigned? This was assigned, Osman, this was assigned at the individual level. So I'm assuming you are referring to the Bal Sakhi program. That was at the individual level. It was at the community level. So the community schools, some of the schools, children were coming together. At the individual level, they were given given the tutors who were the Bal Sakhis. There are some measures that can be put in place to reduce spillover resulting from randomization. Yes, absolutely, there can be. Chris, there are a lot of measures, but it's completely, so there are no general checklists of here are the measures to control for spillovers. One is definitely making sure that you are monitoring on the field very, very closely to make sure these kinds of examples that I mentioned, right? One person walks over from one village to the other. You need to figure out like what the gap, what the geographical barrier that you are going to place so that you don't have to keep monitoring certain kinds of outcomes. I think it will not be unfair to say that if it's the first time you'll ever be working or running a randomized evaluation, you should consider the Murphy's Law. Something that needs to go, that can go wrong will go wrong, but it's always very useful to be mindful of everything that you can do. So depending on the context, there are quite a few measures. And like I said, if you go through our resources, you will be able to find them. Y'all can, again, like I said, email me directly if you have any specific questions. Okay, Philip is asking, is there any way of estimating the distributional impact of an intervention, for instance, on low productivity or high productivity farmer? Sure, this can be done. So you have to think about, say, for example, if you have a stratified sample, or just if your sample is representative enough that has both the high productivity and low productivity farmers, you can, as long as you have a large enough sample size, I think you can play around with that from the analysis perspective. You will see a lot of studies actually do that. So maybe not the South Asia specific, but if you go to, again, the evaluation page, look at other studies, I am fairly certain you will find research papers that are doing that fairly well. And then, can random sampling and random allocation be substitutes? So random sampling and no, so random sampling and random allocation are different. So I'm assuming by random allocation, you're meaning random assignment. Those are two completely different concepts. And again, I'm more than happy to send you all more materials in terms of going through the details. Like I said, if you look at, just to give you a little bit of an idea, the resources that I just showed you, there you will actually find one particular page, which is evaluating social policies. There you can actually go into two particular lectures. One is why randomize and the other is how to randomize. And I think that particular lecture, it's a fairly long lecture. If you can sort of be patient and devote the amount of time, you will learn a lot, and all your questions associated with this more on a very statistical econometrics 101 level might just be answered. Next, basic softwares and tools used for randomization. So like I mentioned, I personally grew up during the time when Stata was high in demand. But as we all know, Stata is extremely expensive, and we have newer things coming up, right? We have R coming up. We have seen a lot of econ students and applied econ students learning R and Python right now. So I would say with JPAL, the most amount of work that we do in the analysis, randomization, setup, all of this happens through Stata and R.
So any other students want to ask a question, you can unmute yourself and ask.
Excuse me.